Hold on. Go live, damn it. Go live. All right, we're live, both. So I'll start again. For those of you who don't know me, my name is Marcus Kiyomura, and I have recently been diagnosed with the rare brain disease called moyamoya. So for those of you who are not familiar with moyamoya, it is a disease that hardens the arteries and eventually prevents proper blood flow from the body to the brain. And so in my particular case, I recently suffered an aneurysm, also known as a stroke in layman's terms, and had to have emergency brain surgery performed. And that scar can be seen right here. And so, along with the diagnosis of moyamoya, there is, how do I put this? Limited options in terms of treatment because it's a brain disease. And so the two options I have to treat it is one type of surgery or a different type of surgery. Fortunately for me, I live in an area that is local to the world's #1 moyamoya neurospecialist. And as you can tell by the stitches still being in my head, I have had the first of 2 moyamoya corrective surgeries recently performed on myself. So if my speaking is unclear at any given time, that's why. Okay, so it's really early in the morning. It's still dark outside, but given said circumstance and my own natural sleep cycle, I have, in addition to the moyamoya, I have chronic insomnia. So as a to utilize this time that I have decided to create these videos both on YouTube and Facebook to help support my GoFundMe campaign. So now that that's said and done, I'm going to hydrate and begin the instructional portion of this video. Okay, so with my latest surgery, I have 2 obvious wounds that need to be protected from infection. Again, the incision site with stitches should be cleaned regularly and daily and treated with antibiotics and protected from further damage with either cloths, caps, or, if necessary, helmets. So that's what this is. The wound I'm going to address today is the one here on my chest. It is the result of what is called a direct line, and A direct line is a device that was used during my surgery to monitor my heart rate directly into my heart. So if that is a little confusing, let me try to explain what was happening. Imagine me, instead of up here talking to you, lying down on a surgeon's table under anesthesia, unconscious. And obviously, doctors wanting to honor the Hippocratic Oath will take precautions to do no harm, which is ironic because, not necessarily ironic. Let me backtrack. Let's just say it is what it is. There's a reason why it's called the Hippocratic Oath. Or am I thinking of something else? Never mind. I'm also potentially susceptible to ramblings and rantings due to ADHD, a mental disorder that stands for attention deficit ADHD, attention deficit hyperactive disorder. So again, if at any time during this instructional video I either ramble or lose my train of thought, please forgive me. Back to the wound, or the direct line. While under surgery, most people are aware of what is called EKG, or heart monitor. It's that machine in the background that's going, beep, 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 and has a variety of different lines going across the monitor. And each of those lines represent a different heartbeat at various points in the body. So it's actually quite unique when doing a surgery. The attachment points for said monitoring nodes will be placed at different portions of the body, as opposed to someone who is in transport or in bed rest, for example, and needing their body to be monitored regularly. So after my surgery, I was admitted to the ICU unit, and I had an IV line inserted on the back of my right wrist, where you can see a dot, and into my left wrist here, where you can see a couple dots, maybe not. Let's not tip over the glass bottle anymore. Anyways, there was an IV inserted in my left wrist in the back of my right hand, and the IV in my left wrist was actually stitched into my hand, so that in the event that I would move, the IV would not come out. And there was a similar situation for said direct line. And so back to the hospital, we have, it comes to a point where it's creating so much discomfort for me due to medications and other factors. It's time to remove the IVs one by one and just kind of de-escalate the amount of monitoring that my body needs. And so I remember very clearly when the nurse told me we get to take out the direct line. The nurse's instructions were to, focus on my breathing, and on her count of 3, hum. So it went something like this. One, 2, 3. Okay, direct line cleared and pulled out of the body. And of course, being a hospital, she was more well equipped with things like gauze and bandages and antibiotics than I am currently at the moment. I am in your average American bathroom at 3 o'clock in the morning. So I do have actual gauze pads if necessary, but I also do have very large size adhesive bandages, which is what I have here. And the antibiotic I have to clean the wound before applying said bandage is camphorphenique liquid. Does not stain skin, pain relieving antiseptic for sores, cuts, burns, insect bites, fever blisters, cold sores. And the rest of the bottle reads on the back: stops pain, helps heal, combats infection from sores, minor cuts, burns, fever blisters, irritated gums, athlete's foot, itchy insect bites, helps prevent the spread and infection of pimples, acne. Camphorphenic powder is also available in a soothing antiseptic powder. Warning: keep this and all medications out of children's reach in case of accidental ingestion. Seek professional assistance or contact a poison control center immediately. Use according to directions. So now to the directions. For external use only. Apply with cotton Apply with cotton 3 or 4 times daily. Ingredients: phenol 4.7%, W/W, and camphor 10.8%, W/W, in an aromatic oily solution. Caution: not for prolonged use. Do not to be used on large areas or in or near the eyes. In case of deep or puncture wounds, serious burns, or persistent redness, swelling, or pain, discontinue use and consult physician. If rash or infection develops, discontinue use and consult physician. Do not bandage if applied to fingers or toes. Okay, so that said, what I have in front of me is, again, a sterile adhesive bandage, the antiseptic camphorphenol, and 500 cotton swabs from Walgreens. So what I'm going to do is take out a cotton swab and place that right here so that we can maintain sterility but that's going to be somewhat, what's the word I'm looking for? It's not necessarily going to be as imperative because we're going to dip the cotton into the camphor phenol by holding the Q-tip into the bottle like this and slowly tipping the bottle so that the cotton absorbs the liquid. And so this is the fun part, so to speak. I get to be a masochist. Only I did this just before starting this video, so you don't necessarily have to get to see me writhe in pain due to the application of the camphor phenol. These other smaller wounds up here on my neck are a result of tape removal and irritability, and probably a little bit of hair removal from said tape. But if I hold up the Q-tip to the camera, you may or may not be able to see a small little red dot. That is evidence of cleaning the wound. In this case, probably a scab. So I'm going to use the other end of the Q-tip to do the same thing for my incision site, because I don't like wasting materials, and this is again something that I need to do daily anyways to prevent infection. So again, I'm going fairly gently from top to bottom, and again bottom to top of the incision site of the surgery. And in this case, if I again hold up the Q-tip to the camera, you may or may not see very tiny specks of red and brown, which is evidence of dried blood, also known as scabs. And so I'm going to throw away this Q-tip now and apply the bandage now that it has been sterilized. The other thing you may or may not have noticed about how I'm doing this is I'm not only right-hand dominant, but as a result of the recent surgery, I am weak left-hand. My left side is still very weak to the point of it is this hard for me to straighten my hand out like this. I can't do that at the moment. It takes a great deal of effort, and who knows how long I'll be in rehabilitation or physical therapy to get back to this point. Anyways, back to the wound. I'm going to stabilize the Band-Aid and peel back the whoops. All right, so again, back to sterility. We're a little lucky because the Band-Aid is still covered. And so even though it did fall on the floor, I'm going to choose to still use the same Band-Aid as opposed to getting a new Band-Aid. One thing I forgot to show on camera was actually cleaning my hands before doing all this, but I'm gonna pause for a moment and do that now before I actually do leave myself prone to infection. And again, I'm not necessarily in a hospital grade sterile environment. I am in a average American bathroom. So instead of using a towel to dry my hands, I'm going to opt to just air dry and shake out the water like so. The good thing about this method of choosing to dry my hands is it gives my left wrist a good exercise in range of motion. So those of you who do not believe in multitasking being an efficient way of doing things, here's your evidence against said theory. Anyways, back to the Band-Aid. What I'm trying to do is prevent my instinct, given my weak side, is to use my mouth or teeth to brace the Band-Aid, but that is something that can lead to infection, given that I did not brush my teeth before this video. So we're going to show how this process works with 1.5 hands, as I call it, or with one good hand and one weak hand. And I'm going to show you now a little closer. If you look at the Band-Aid, you can see that I simply need to try and separate these two pieces of cover. But given either how old this Band-Aid is or my disability, it's taking a little longer than expected. But right on cue, I get to separate the two covers like so. And I will proceed by stabilizing the Band-Aid with my weak hand and using my weakness to my advantage, because I do have some strength in the left hand, obviously. It's simply, at this point, lacking dexterity and control. But due to the surface of the bathroom sink here, it is still an obvious challenge. And okay, one piece removed. Well, fuck me. Okay. All right, that said, this time we're gonna do the right thing, get a fresh band-aid. And let's hope that I don't repeat the same mistake again. In fact, this is a good opportunity to keep statistical analysis of how much materials might be wasted as a result of me being on my own, as opposed to calling for help or assistance with this procedure. So we're counting that band-aid as one attempt and this band-aid as two. So this time, to prevent the band-aid from falling to the floor, I'm gonna just simply rely more on my dominant and strong hand to remove the covers. Back to that idea of multitasking. Therapeutically, or in terms of my rehab, I want to use my weak side as much as possible to, what's the word I'm looking for? To rehabilitate the weak side and help it return to baseline. Again, taking the weakness of extending my hand from this to this. But in this case, because of the importance of maintaining sterility and at this point not wanting to waste more materials, I'm going to do this one-handed as much as may be needed. But in this case, I'm going to decide to bite the bullet, so to speak, and use my mouth to remove the cover. Like so. And with my dominant hand, I'm going to carefully bring the band-aid to a point where I can grasp the adhesion again and remove it. And you can see from the use of the teeth, the downside is the paper, it gets torn instead of pulled. But I'm not going to be concerned about that because we do have an antiseptic. So at this point, I'm just going to remove the band-aid with my good hand. And now, obviously, that I have the band-aid off, I can apply it to the wound and hope that it sticks, because I do not have medical tape nearby to hold it down if it does not. Okay, that's that. So let's get rid of the garbage and put away some of our materials. The cotton swabs and camphor were in this drawer when I began this video, but after reading the warning label, I'm going to put it in a different one that has child-proof locks. Like so. Okay, so success, right? The goal was to clean the wound here and dress the wound here, because this is a sensitive spot that consistently throughout the day while clothed receives a lot of irritability and friction. And so it's important to protect the wound from infection by dressing it like as I just showed you, I guess. Anyways, thank you for watching, and if you don't find me on Facebook, look for me on look for my GoFundMe campaign via search keyword moyamoya. Thank you very much.